Well, good evening, everybody. Thank you for coming out this evening and coming out and listening to our workshop on lower back pain and chiropractic care. Yes, it is both effective and safe. For those who don't know me, my name is Dr. Scott Misek. I'm a native of Nebraska. I'm a graduate of the University of Nebraska at Lincoln with a degree in pre-med and biology, and I graduated in 1986. I went ahead and was accepted to Northwestern College of Chiropractic in Minneapolis and received my Doctor of Chiropractic degree in 1990. After graduating from chiropractic school, I came back to Omaha because I have family and friends here, and started my practice right in this location. I've been here ever since. So what I use in my practice to evaluate and treat patients is what I call an evidence-based approach. Now, what that means is, I try to keep up on all the literature, all the chiropractic literature that I can, all the studies, all the new research that's coming out on the effectiveness of chiropractic treatment and treatment plans and different modalities that help people with their lower back pain and their chronic lower back pain. So my approach is very scientific. It's not based on what I feel. It's based upon the facts, and it's based upon recent guidelines, scientific guidelines. I do practice a variety of chiropractic techniques. My go-to chiropractic technique has always been a manual adjustment, but there are some individuals and certain conditions that that would not be a good treatment for. So we have other treatments and techniques that we utilize in our office, whether they be soft tissue techniques or non-force techniques as well. So we do and practice a variety of techniques based upon your condition and what will get the best results. We do have x-ray in our office, and we only utilize that when it's absolutely necessary. If an individual comes in and after doing a consultation, a history examination, we find that x-ray is necessary and would be a good component to understanding the underlying structure of the body, we'll go ahead and order those and take those that same day. Not only in addition to my chiropractic techniques, I'm also very proficient in multiple physical medicine techniques, certain soft tissue techniques, the use of ultrasound and electric stimulation, and there's a variety of those as well, so very proficient in those. Now, because I've been in practice for 27 years, I've developed quite a bit of a physician network here in the Omaha area. So if we find that yours is not a chiropractic problem, we have a group of wonderful professionals that we feel confident in sending you to for whatever condition that you have that would respond better by using those professionals. Lastly, our office stresses patient education and patient participation. Not only do we want to have you understand what your problem is and what we expect in our prognosis, but we want to make sure that you're asking questions, or if your spouse has questions, they certainly are welcome to come on with you to your appointments so they can have their questions answered. Many times a spouse has, or a friend even, has better questions than you do because there's a lot of noise sometimes in people's heads. So we want to make sure that we cut through that noise. We want to be able to educate and explain things in a way that you have a very thorough understanding of your condition and your expectations of care. So, without further ado, let's go ahead and start in here. Now, we find that chiropractors have always known that correcting the problem is more effective than masking the pain. Well, that just seems like a no-brainer, doesn't it? But we find in our medical offices that it's kind of the opposite, in that you come in with a symptom, and by golly, we've got pills here that help address that symptom, whether it's pain or muscle spasm, and that's the approach that they take. But we find that that's one that's just kind of masking the problem. That's like looking at putting a Band-Aid on a cracked shell. Now we all kind of laugh at that. That's really the kind of the common approach initially when we see a primary care provider, in that they take a look at you. They may or may not even touch the area of complaint, but say, it's probably a simple muscle strain. Here's some muscle relaxants. Here's some medication for inflammation. Call me later if it doesn't work. We'll see you later. Well, chiropractic knows that if we just address the symptom, we never get to the root cause of the problem. So we take a much different approach. Now we're going to go through a few research articles here, kind of give you an idea of how I approach chiropractic care of lower back pain, and look at the supportive evidence that supports chiropractic care for lower back pain. So this was a study that came out in the journal Spine in 2015, and it looked at lower back pain and prescription medications versus spinal manipulation, or what we call chiropractic adjustments. So on the left-hand side of the screen, we find that 56% of the individuals that were getting the medical care, getting the pills, they had a 30% reduction in lower back pain at 4 weeks. So 56%, about half of the participants, felt 30% relief in 4 weeks. Compare that to 94% of those individuals that were under chiropractic care, in fact, a manual adjustment chiropractor, found that they had 30% reduction in their lower back pain after 4 weeks as well. So about twice as many people felt the same in a very short period of time. So better results, faster results, and just a great little research information here. The next one, this is about workers with lower back injuries. This was a study that was done and showed up in Spine of 2012. And this study looked at the first point of contact for individuals and their likelihood of going on to low back surgery. And so we find on the left-hand side of the slide that in this group of folks, the first point of contact was a surgeon, an MD. And we find that 42.7% of those individuals that saw them first went ahead and ended up having low back surgery. Compared to the first point of contact with a chiropractic physician, only 1.5% of those individuals ever went on to get low back surgery. So this is huge. This is really significant. So just in those two studies, we find that science has kind of caught up to where chiropractic has always been, and that's fantastic. So science helps us validate what we do and how we do it. But we also know that lower back pain is a condition that just really at times will just kind of improve on its own. Well, you've gone out and you've raked some leaves over the weekend. And if you go home, you go inside, you rest, you put ice on it, you stretch, and over the next couple of days, maybe you've even taken some pain medication, the condition's kind of resolved on its own. It's not uncommon for somebody to call my office and talk to me. They've done something to their lower back. And I always say, let's wait a day or two. Let's see if it calms down on its own. And if it's self-resolving, great. You don't need to come and see me. But if after 3, 4, 5 days, the pain's not getting any better, it's actually getting worse, you're not sleeping very well, those are good times to give us a call to get you in and see what's going on. We also know that lower back pain tends to follow a pattern. If you've injured yourself once or twice or 3 times, and then you have episodes of lower back pain, and we find that sometimes those episodes become more frequent, they'll become more intense, and the length of the time that you've had it or will have it seems to extend longer and longer. And that's pretty common with people that have chronic lower back pain. Well, spinal manipulation or chiropractic adjustments is really showing to be one of the most effective ways to resolve back pain with less risk of re-injury. We find that folks that come in and see us on a periodic basis to get wellness care, just to make sure that their body is working the best that it possibly can, we typically see those people have very, very low incidence of re-injury or reoccurrence of their lower back pain. And if in fact they do have an incident where they do have an injury or aggravation, that time that they have it is cut down in half, and even their intensity of pain is reduced during those episodes of pain as well. So great findings for those that come in with chronic lower back pain. So here's one study. This was done in 2007. This was a collaborative study between the American College of Physicians and the American Pain Society. And these are medically based groups that actually stated that spinal manipulation was one treatment option for physicians to consider for lower back pain. Well, these are huge studies because until these studies came around, MDs did not recognize chiropractic as a viable option for lower back pain, even though chiropractic had been around for well over 100 years. So we're seeing some good science behind this, and the medical groups are now recognizing as chiropractic as an option and a treatment and an effective treatment for lower back pain. Here's another agency for healthcare research and quality. This study was done in 2010. And they found that spinal manipulation was equally or more effective than medication in reducing low back pain intensity. Now that's huge. That's going against the well thought out medicine's the only way to reduce and cure lower back pain. So now they have to grapple with understanding that chiropractic is a viable, effective treatment for people with lower back pain. And we find that to be great. Then in 2011, we have a review of 26 clinical trials. So not only did we look at 1 or 2 or 3 or 4, but we actually looked at 26 clinical trials. And they looked at spinal manipulation for chronic lower back pain. And they concluded, after looking at all those trials, that chiropractic care was effective for reducing pain and, more importantly, to improve the function for as long as 18 months. Now that's huge. Our approach to treating lower back pain or any condition that we see in our office, number one, is to reduce the pain that you're experiencing, but number two, to also improve your function. So things that you would like to do but couldn't do anymore. Let's say you like to play golf and you couldn't do it because of your lower back pain. Can you go out and golf with some pain? Yes, you can. But you can't go. You can't go out when the pain's so high and so debilitating. So not only do we want to reduce the level of pain that you're experiencing, but we also want to improve your function in life to do the things that you enjoy doing, whether it's playing and picking up your grandkids, bicycling, playing golf, any kind of outdoor activity. We want to make sure that we're improving the function as well. So after all these years, after all these studies, our medical counterparts have developed evidence-based clinical guidelines for people with lower back pain for their own physicians. So this is the kind of recommendations that they're making to their own physicians. So for acute low back pain patients, the patients should remain active. So we want to, instead of telling people, go and lay down and bed rest and don't do anything, or put you in traction in the hospital for 3 weeks, we want you to remain active. So that's the recommendation. Remain active and consider, now get this, non-drug therapies, including spinal manipulation. How fantastic is that? Especially in patients that have pain that persists more than 4 weeks. That's huge, folks. It's the primary care providers that are recognizing that, one, folks are tired of taking a lot of medications. Folks are tired of not getting any answers of why they have their problem. It's not just as simple as saying it's arthritis or you have a chronic lower back pain, or it's, if your dad had lower back pain, you're going to have lower back pain. They're finding that these studies show that chiropractic care is a viable treatment option for people that have lower back pain. That was acute lower back pain. They're also finding that people that have chronic lower back pain, that the patients will, and this is what they're saying, they're not likely to become pain-free, but they may benefit from non-drug chiropractic care to improve function. Well, I'm going to let you in on a little secret. We've had a lot of chronic low back pain patients that have seen us over the years, and we find that a great majority of them do become pain-free. Not only that, but we improve their function as well. So it's a great treatment. It's a great option for those who don't want to be taking pills on a daily basis for the rest of their life. So again, the main goal in our office is to relieve the individual's pain, but to also improve your physical function as well. And chiropractic really offers a better approach to lower back pain than what this slide talks about. And this is a tragedy. We all have heard about the opioid epidemic. People, this slide just kind of illustrates, that there's 78 people that die each day from overdosing on painkillers. And the folks that are out there prescribing these painkillers, are doing it at such a rate, and these folks that are taking it can become addicted to those pain medications. And we don't want anybody dying. We want to make sure that they're getting the right care. And sometimes for some of those folks, it may be a combination of some medication and some chiropractic treatment. But to be judicious in the use of the amount of pain medication is really where we need to be. And if we can get and treat these individuals without any of this medication, so much the better. There's no addictive effects on chiropractic that I'm aware of, and it's very, very safe, and it's a great option for people that are suffering from lower back pain. So I just kind of want to go over here in the next few minutes, our approach, basically my approach to a lower back pain patient that comes in and sees us. We always welcome questions. We'll give you a phone number here in just a few minutes. But if you have any questions, to give us a call, and I'll certainly get on the phone if I can, or call you back if you have any specific questions before coming in and seeing us. But this will be the typical approach that we'll take for somebody that calls in for an appointment as a new patient. First thing we're going to do, I know I call it the dreaded paperwork, but it really gives us so much information about you. We want to make sure we take a thorough history, and that includes a past history. Not only a past history of traumas to see if we can understand the relationship of old injuries to how you are presently, but we also want to make sure we look at the medications that you're taking, because medications can many times cause side effects that cause other problems to occur. So we want to make sure that we're not dealing with any adverse side effects of medication. And actually, we want to look at any past surgical histories that you've had as well. So individuals that have lower back pain, they may also have degenerative knee problems, and they've had multiple surgeries on knees, or they've had problems with their hips or hip replacement surgery. Just because we've had a surgery, that doesn't mean, and we've fixed one area, doesn't mean that we can't produce some ongoing lower back problems because of working on a different area. So we look at past surgical history as well. The next thing we do is perform a thorough examination of the area of complaint, but we'll also look at other ancillary areas too. Again, if you've had knee problems or ankle problems, we want to see if those are contributing to, or if those areas are as a result of your lower back pain. But our examination is going to be hands-on. Certainly is going to be hands-on. We're going to test range of motion. We're going to see how far you can bend, how far you can move, what kind of restriction is in your movement, and does it cause you pain and discomfort. We'll have you lay on our examination table. And we're gonna palpate. We're gonna feel the spine. We're gonna look for individual motion. We're gonna look for and feel for pain and muscle and tissues that are inflamed. We're gonna find that by doing our hands-on examination. Then we're gonna do some orthopedic tests. We're gonna differentiate between joint and muscle and nerve and see exactly what's causing your problem. And that'll be our examination. When you're here in our office for the first time, you're probably going to be here for 45 minutes to an hour. We're going to really spend some time in understanding your condition, understanding you as an individual, see what your needs and wants are, and to give you the best care that we possibly can and get to the bottom of your condition. If we find that your condition would be better looked at and viewed by x-ray, we'll go ahead and order those x-rays and take them right here in the office. Ordering just the minimal number that we need to render a diagnosis. If we find that your condition would require some additional testing, things that are more advanced than we would have in our office, like an MRI or a CT or even blood work, we'll go ahead and order that and get those results back and then sit down with you and go over those results, because what we want to find out is, one, are you in the right place for the right thing? And if we find that you're not, then we need to move you on to those other professionals that we feel will give you the best care possible for your condition. Again, we're going to use that best evidence, those guidelines, to develop a prescription of care. I like to call it a trial of treatment or a trial of care. Any prescription that you get is always a trial of treatment. You know, it's not uncommon. You get prescribed a month's worth of medication. Your doctor says, let's get back in a month, see how that did for you. So everything's a trial of treatment. We want to make sure that we're giving you the best care in the shortest amount of time to get the best results. And then we're going to reevaluate periodically to measure your progress. So how do we measure your progress? We'll do some of the same tests that we did on our initial evaluation. Range of motion, orthopedic tests, maybe some pen and paper tests that we have you write out so we can see if there's been any change in your function over time. And again, lastly, if we find that your condition is not improving with chiropractic care, or you're not in the right place for the right thing, we'll go ahead and refer you to other professionals in the Omaha area so that we give you the best chance of getting better in the shortest amount of time. So, in conclusion, certainly, we're always here for you. We've been in the Omaha Millard area for the past 27 years, and we always welcome your questions. Again, give us a call. We'd love to talk to you before you come in. If you feel like you want to just make that appointment, go ahead and give us a call. We'll get you scheduled right away. We have very convenient hours for you throughout the week, and we sure hope that you've enjoyed this presentation, and we hope that you come back and see us real soon. Thank you, and good health to you.